Whooping cough, or pertussis, is a persistent cough lasting hundreds of days, often accompanied by post-tussive vomiting but typically without fever. This highly infectious illness necessitates isolation to prevent spread. Fortunately, it is easily treatable with macrolide antibiotics, including azithromycin, erythromycin, or clarithromycin, for a duration of 2 weeks. Supportive care such as steam inhalation, a protein-rich diet, and adequate hydration can also aid recovery and alleviate symptoms effectively.